You just got released from the hospital after a whirlwind of labor and delivery. You're now going home. You're tired. You're exhausted. You probably haven't slept. Your body is fatigued. You've got lots of things to do at home, and you've got a baby in tow, and your husband equally probably bewildered, or your partner going along with you. Postpartum care is actually a full stage of your recovery, and it's important to maximize your recovery when you're in the postpartum period because it can have a significant impact on how you respond to your baby, how your baby responds to you, and how you recover. So let's talk about a few aspects of this. Number one, for many of you, you will have some degree of perineal tear or laceration, a cut at the base of the vagina. Sometimes they're small, sometimes they're big. How do you manage these? Number one, nothing goes near there for 6 weeks. Your partner may feel frisky, but it's not a good idea because it could tear apart stitches, cause infection, and will definitely cause you a lot of pain. Number two, use either one of those squirt bottles or hop in a little bit of warm water in the bathtub for about 5 minutes. Don't wait until you prune. That's not recommended. Just come out after a few minutes, make sure it's just warm, not piping hot, and pat the area dry with a towel you don't care about because it may get some blood or debris on it. Number three, ice is your best friend. Take some maxi pads, throw them in the sink, throw them in the freezer. Some people like to add witch hazel, coconut oil, aloe vera. I don't actually think any of that matters, but if you want to try that, great. And apply that on for 20 minutes, off for 20 minutes, because it'll help a lot with. Number two, let's talk about pain control. Many of you are afraid to take pain medications because you're worried about the baby, especially if you're breastfeeding. There are no risks to using anti-inflammatory meds like ibuprofen, ketorolac when you are breastfeeding for the baby. It does not pass in sufficient quantities to the baby to cause any kind of harm that anyone is aware of. Also, for those of you who have had an episiotomy or a tear or a cesarean section, you're going to need some narcotics. And morphine is a perfectly safe drug because, again, minimal amounts get into the breast milk. You are not going to fatigue your baby, but it will give you adequate pain control. In some cases, we used to give moms Percocet or Tylenol 3 in an effort to help them with their pain. But some babies or moms are rapid metabolizers, causing very high levels of the drug in the breast milk, and the baby can actually get overwhelmed. And there have been cases of neonatal death or respiratory compromise leading to very significant problems. So avoid Tylenol 3 and Percocet if you are breastfeeding for sure. Number three, sleep. Sleep is an important part of your recovery, and you're going to need some help usually to achieve this. Make sure you are getting enough rest because it affects your chances of developing depression. It affects your breast milk production, and most likely, and it can affect your ability to function on a normal day-to-day basis, including memory, cognition, ability to process and deal with events that are. So make sure that your postpartum phase is equally as important as getting to the pregnancy, getting